Conscious sedation differs from general anesthesia in that in a general anesthetic, a patient is completely insensate, asleep, non-responsive. That's provided for major surgical procedures. What we're doing here is conscious sedation, in which we provide a small amount of intravenous medicine that allows us to communicate with the patient and have the patient be comfortable. So they may experience part of the procedure, but they certainly don't describe it as terribly painful. Communication lines are maintained, and yet the patient's relaxed and relatively pain-free during the procedure. Generally, patients that have conscious sedation, the procedure, after the procedure is performed, they head to our recovery area and we give them something to drink, something to eat, and they can usually get home within an hour. I think just the anxiety decreases. As we administer the sedation, anxiety goes down, the pain from the procedure is experienced by the patient as less and pretty tolerable. We're able to move efficiently through the procedure without patient experiencing it as uncomfortable or painful. My attitude has been, for the last 20 years or so, as a practicing anesthesiologist, that I have an obligation to guide patients safely and comfortably through a procedure, and that's my obligation for the patients. There are some in the medical community who feel that conscious sedation is not indicated or not medically necessary, and I would have to disagree with that thought. I mean, when you go to have a colonoscopy or some kind of procedure performed by a gastroenterologist, you expect to have some sedation before the colonoscopy and during the colonoscopy. And I think this is normal and expected in modern pain management and other areas. And so I feel that conscious sedation is critical to guide patients through these procedures to attempt to alleviate pain in the most responsible and caring way that we possibly can. We don't insist upon the performance of the use of conscious sedation for every procedure. For example, some patients may say, well, look, I want to drive there. I don't want to get sedation because I want to be able to drive home. So for those patients, we're very happy to provide the procedure without sedation. We numb everything up. It's fairly well tolerated in a motivated patient. We just find that there's enough anxious people that most of our patients, some 80 to 90%, obtain sedation and request sedation.